is different. And then I'm going to go through the agenda, if that's okay, with everyone here. And before we kick off with our first session in about 12 or 13 minutes. So, healthcare is undergoing probably the largest transformation of its history. This digital transformation that has taken all of us by storm that work in the healthcare space is never ending and is accelerating in many ways. We are integrating more systems in more locations with more trusted providers for the meaningful exchange of health information between insurance and government and various provider outfits. With each year, there seems to be more connections and more data duplicated in different locations. This digitalization has really transformed patient outcomes. It's allowed us to reduce patient morbidity and mortality and to improve patient lives. Less people sat in wheelchairs, and more people that are diagnosed early with problems that can be treated and can resume a normal lifetime, a normal lifestyle. But it's also introduced new risks, right? With the digitalization of health information data, it has been a magnet for cyber attacks, organized crime that can easily monetize PHI, PII, and increasingly intellectual property, particularly clinical research. And this has brought in some of the more pariah nation states that are intent on making their industry the leader in the world and will not really care as to where that information has come from. And a lot of our research hospitals and our pharmaceutical organizations and our universities have been absolutely pillaged by a deluge of highly organized cybercrime, stealing intellectual property. And this has been, personified by, some of the research that's gone on recently into COVID cures. Hospitals in Brno in Czechoslovakia, right the way across or the Czech Republic, I should say, pardon to Czechs and Slovaks that are on the call. But the University of Brno has been attacked. A number of other university systems, labs, pharmaceutical organizations have been attacked within this year alone, right? By nation states out there trying to get a COVID cure or to accelerate their own COVID cures that much faster. We have a bigger footprint of connected devices at the same time, right? It's not just the fact that we are integrating these systems, but we're adding systems the whole time. And this has perhaps been no more so noticed than in the absolute exponential growth, for want of a better description, of healthcare IoT space. Everything from building management systems, which are now on the network that used to be standalone systems, things that control elevators and escalators and HVAC, right? What would happen in our hospitals if HVAC were to break down, particularly with a pandemic such as COVID going around? It would make disease control almost impossible. What would happen if elevators stopped working? We couldn't transfer patients from ICU to operating theater to isolation to post-op recovery, or get them, take them to radiology for an X-ray or a CT scan, right? These are things that are critical to the workflow of a hospital. And increasingly, medical devices are becoming critical to that workflow. Things like network-connected infusion pumps that administer drugs to patients, nurse call systems, patient telemetry systems that measure everything from O2 saturation of a patient to their pulse, their heart rate, and gives them a blood pressure reading every 20 or 40 minutes, depending on how the automated blood pressure cuff has been configured. Long are the days gone of a nurse calling on a patient every 30 minutes just to check on them and say hi. We don't have enough nurses for that luxury today, and obviously those are a very costly concern as well. The digitalization is not just about health IT, but it includes that growth of health IoT and also OT systems, things that we use in our laboratories, right, for drug testing, for example. It includes all of the connectivity with labs, with robots, things like pharmacy robots, Pyxis cabinets for dispensing drugs, robots that take medications from the central pharmacy out to the different parts of the hospital and take patient records to medical billing, for example. These are all things that are indicative of today's healthcare system that are very, very different from where healthcare was when I started out in the business 25 years ago. What happens when HVAC fails in a pandemic? There are a number of hospitals that have now expanded to the parking lot. They have tents which are filled with air that vent out polluted air into the environment out of a chimney or through a decontamination system in order not to infect those that may be at that same level. These are now critical in our systems. The trouble is that most hospitals haven't really looked at the HIOT factor. They haven't really looked at what the impact is of integrating things like artificial intelligence and machine learning and other technologies into the mix of clinical applications that are used to support patients today. And this is something that we obviously need to spend a lot more time looking at, right? And that's one of the reasons why I joined Cylera a couple of years ago, in order to kind of spearhead what Cylera is doing in the healthcare IoT space and in assessing medical attached medical devices to the network, understanding the risks they present, and remediating those risks in an automated fashion. Whichever way you look at it, healthcare needs security help, right? We've got a very changing environment here. We have a lot of things that are in a state of flux, and healthcare can no longer go it alone. And I think the numbers speak for themselves. If we look at what has happened over the past 5 years with ransomware attacks against healthcare, and how badly healthcare is impacted when systems go down. Patients can no longer be seen, and we've seen what happens when patients can't be seen at a hospital because IT is under a ransomware attack. Patients die, just as an unfortunate woman did in Dusseldorf University Hospital as recently as a month ago. And there have no doubt been many, many more patients who have died where that information hasn't trickled to the surface for obvious legal liability reasons. But I think we're probably going to see more honesty in that as we move forward. So we need help. We need help with everything from risk analysis on our healthcare networks, right the way through to cyber incident response, preparedness, and incident handling, forensic investigation of incidents, through to things like simple things, day-to-day things like getting a better grip on who has access to what, and implementing zero trust, whether it be at a user behavioral analysis level, or whether it's at a system anomaly detection perspective. How can we get in front of cyber criminals? And I think this is really the challenge for the healthcare industry as we move forward. And it's going to take partners. It's going to take lots of partners. And hopefully some of the folks who are on this call today are instrumental in helping us take that to the next level. So we have some great speakers here lined up for you over the next 5 or 6 hours, I guess, all in all. A very full day of activity, and I'm going to share some of those with you here today. So this agenda can be found on the mssconference.com page, healthcare.mssconference. And I suggest that you take a close look at that. And you are obviously welcome to come and go as you need, based upon your schedule today. But we would appreciate, obviously, the more sessions that you can attend, the better. We've got some great speakers lined up here, as I mentioned. We're starting off in about 4 minutes' time with a session on zero trust micro-segmentation and clinical asset security services in the era of COVID by Emmanuel Jackson and Charles Sackley from Everston Technology Partners. That's going to be followed at 9:30 Eastern, 14:30 GMT, by a panel that I'm going to be moderating on clinical cybersecurity. And do we need a clinical cybersecurity officer in order to transcend the gap between the technologists and the business folks on one side and the clinicians and the caregivers on the other side? And I'm joined by two esteemed UK leaders in the cybersecurity space, one of whom leads a number of NHS trusts, and the other of whom is an MD and is now focused purely on the cybersecurity space. At 10 Eastern, we're going to be moving to a session by Mike Ahmad of AMB, apologies, haven't had enough coffee here yet, on the complexities of medical device management, another topical area that I'm sure will be worth your time. Then at 10:30 Eastern, we have our Biomed Clinical Informatics Operational Security panel. This is a, a very large panel full of highly esteemed speakers here, including Professor Benoit Desjardins, Associate Professor of Medicine and Radiology at the University of Pennsylvania, Dr. James Balshi, who is CMIO at St. Luke's University Health Network, Robert Stillman, who's Director of Clinical Research and Informatics at Ohio State University Wexner Medical Center, Tracy Hughes, who is Senior Director of Biomed at Duke Health, and Seth Bogey, who is IS Director and responsible for basically keeping things safe and secure at Penn Medicine. So that's going to be an hour-long panel. It's our longest panel of the day, and I think there'll be a lot of people tuning in for that one. I know I've heard a lot of these speakers before, and they're some of my favorites. At 11:30, we're going to be talking about threat intelligence and looking at Threat Actor 101 for healthcare providers. And this is being provided by Tom August, who's an award-winning CISO and has written a number of books in the particular space and managed a number of healthcare systems throughout his career. At noon, we have a panel on securing the internet, securing the healthcare Internet of Things by Esmond Kane, Hussein Syed, Mike Cylera, and Seth Bogey, some CIOs, and CISOs there in the healthcare space that know the IoT space particularly well and are sharing their thoughts. We have a lunchtime keynote at 12:30 being delivered by Michael Hamilton, who is CISO and founder of CI Security, on going alone versus extending your team. Then at 1 o'clock, we have another panel, Catch Intruders in Minutes, Not Months. And this is being led by Drexter Ford and healthcare strategist at CI Security, Benjamin Smith, CISO of Nuvance Health, Logan Wolf, the CEO of Wembley Partners up in Canada, Mike Bray, the CISO of Vancouver Clinic over in Oregon, Powell Hamilton, the CISO of El Camino Health in California. So hopefully our West Coast folks will be awake by 1 o'clock Eastern this afternoon and ready to go for this one. Then at 13:30, 1:30 Eastern, Yana Kurikov is going to be talking about why it's important to plan for cyber incident response and what you need to do in order to survive a cyber attack. Then at 1400 hours, 2 p.m. Eastern time, we have another panel on should we develop a healthcare specific MSS. That's being led by Anahi Santiago with Taylor Lehman, Chris Friends, and Robert Perry, a nice collection of security leaders there. Then at 2:30, we have another presentation on securing the healthcare data supply chain, and that's being delivered by Brian Selfridge with Metatology Services and Jay Stewart at Coral Technologies. At 3 p.m. this afternoon, we have another panel on why healthcare needs solid physical security. And this is being run by Eric Smith, by Brett Cattell, Tom Buns, and Martin Green, who are all involved in ensuring the physical security of our hospital systems. And they've got some interesting insights there that talk about more than just CCTV cameras and running drunks out of hospital waiting rooms, and why it's so important to protect the physical security of our systems. Then at 3:30 this afternoon, we have our closing keynote delivered by Mark Sangster, who's going to be talking about building cyber resilience in digital medicine, finding factors, not fault. And then Phelim, our host today, will be winding up at approximately 4 o'clock this afternoon. So please take a look at the agenda and please join as many of these sessions as you possibly can. And you can pull that down, obviously, from the website at healthcaremssconference.com. And with that, I think we're about time for our first session, Phelim.
Absolutely, yeah. Thanks very much. A lot of energy today, lots of presentations, lots of content, lots of topics. Please be boisterous and enthusiastic in the audience. I know Richard is giving his all as moderator, so that's excellent. We've got a fantastic packed day today. But yes, Richard, I think it's time to start and bring up our first speakers of the day. What do you think? Are we good to go?
I think we could be. If you can
I'll
escalate their privileges.
Oh, okay, fantastic.
Something everyone in security will know all about. Privilege escalation here.
I know, wonderful. And we have a couple just for this morning on Facebook because they particularly want to view things from Facebook, but that's okay. That's their particular preference. So I've just invited up our fantastic speakers this morning, Emmanuel Jackson and Charles Sackley. Thank you very much to Everston Technology Partners for supporting this event. Emmanuel, how are you doing?
I am well, thank you. I'm happy to be here. I put on a suit today.
Ah, lovely, very nice.
That's a little unusual. I almost wore a tie.
Well, I'm thinking maybe I shouldn't have gone so bright with my tie, but there you go. It's a healthcare event, so I feel it's the time.
I think you're right.
And Charles, nice to welcome you. How are you doing?
I'm doing great, thank you. Excited to be a part of this.
Fantastic. Well, the floor is over to you. You can share your screen as you would like, and very keen to hear your presentation.